Hey, good morning, everyone. Thanks so much for joining us. We're gonna give folks about 30 seconds to join before we get started. And so just bear with us for 30 more seconds before we kick off today's event. All right. Well, for the sake of time, we're going to go ahead and get started today. And thanks again for everybody who was able to join our briefing this morning, Reining in Healthcare Prices, Opportunities in the Texas Legislature. For those who don't know me, my name is Sammy Curley, and I am a senior advisor, or I am an advisor at Small Business for America's Future. For those who are not familiar with SBAF, there's a little bit on the screen about us, but for the sake of time, we're going to go ahead and keep rolling through here today. But before we get started, I do want to take a second and thank all of our wonderful partners for today's event. And for all of those on the call who are part of these organizations, we appreciate you for joining us today. In just a second, I'm going to introduce my good friend, Charles Miller, who's the Director of Health and Economic Mobility Policy at Texas 2036, as well as the Board President for Texas Employers for Affordable Health Care. But really for today's call, we wanted to have folks spend some time with all of the rising costs of healthcare continuing to go up and how it's a top issue facing businesses large and small. We felt there was a need to talk with business owners about how these health issues are impacting their businesses, and how high prices are impacting tough decisions that they're making regarding their bottom line. And so now I'd like to introduce to you all Charles, who has a long history working within the legislature on healthcare issues, to spend a little bit more time with folks about why this is important and why folks should be paying attention. So Charles, why don't you take it from here?
Sammy, thanks so much. Appreciate you putting this together and happy to be here today to talk about how this is impacting businesses and maybe some opportunities to help. Let's take a look at that next slide here. So you guys who are all here, if you responded to this and thought that this was something worth seeing, you guys probably know this already, that this is a big deal for your business. And we know that the high and rising costs that you're experiencing are not just business expenses, but they're impacting your ability to grow your business. They're impacting your ability to attract and retain talent. They're impacting your ability to focus on what should be the core of what you do, which is your business and not your healthcare. And you see some stats here. We've been doing surveys of business owners in Texas and continue to find uh, just consistent findings like this, that this is a problem for businesses throughout the state. And so it's one that we're working on. Let's take a look at the next slide. It helps to put numbers to this. And this chart on the left is showing just how rapidly the cost of a family insurance premium has gone up. These numbers are actually a little bit out of date. I just saw some new numbers out there. The average family premium is now $25,000 a year. And to put that in context, that's about 1/3 of the median household income. So this is just a huge, unsustainable burden on families, your employees, and what they are dealing with. And you guys are bearing this. And there's no really end in sight. We look at the chart on the right, these costs are expected to continue to go up. We are hearing in premium increases of averaging between 8 and 10% a year going forward. So while we're already really high, there's no end in sight for this. Let's go ahead and take a look at that next slide. One of the key things that we have seen that gives us, hope for what we might be able to do to change this is we have some new data. Historically, when we've gone and talked about this issue at the Capitol to policymakers, the argument that we've always heard is that businesses and their employees have to pay more for insurance because public payers like Medicare and Medicaid and the cost of the uninsured charity care is so high that that shortfall needs to be made up for by the commercial payers and their employees. And we finally have data on this to evaluate this claim, and it turns out that it isn't true. Just to briefly explain this, we had a bunch of number nerds go crunch through a bunch of federal filings that hospitals have to file with the federal government every year. And they looked at this and calculated all of the revenue and all of the expenses that hospitals receive outside of what employers are paying, and then figured out what employers would need to pay in order for those hospitals to break even. And that's not to suggest that hospitals only need to break even. They are ongoing entities, and you guys know as a business, you need to make more than break even. You've got to have enough money in reserve so that you can account for unexpected certainties. So this is not to say that they only need to break even, but it is a starting point. We also then had this great study done by Rand that went out and looked at what are commercial payers, employers actually paying. And so this chart on the left shows that our median employers are paying about 300%. That's 3 times what Medicare pays for a service. Meanwhile, what those hospitals need in order to break even is about 120% of Medicare, or 1.2 times. There is a huge delta there between the argument of what is needed for that cost shifting purpose. So that's that 20% above Medicare. That's the cost shift that's going on. The rest of that is just profit. And there is a huge room for those prices for commercial payers to come down without actually impacting the financial viability of our ability to deliver services for everybody. And that is driven, what we have seen the research shows, by excessive consolidation and market power that is creating a non-functioning market. There we have our problem. Slide. So now that we've identified what the problem is, which is this excessive consolidation and excessive gate of market power, we have also what our policy opportunities are. There is an issue of facility fees. Now, this is something that impacts both consumers, your employees, who are receiving these kind of surprise bills, but it also has this underlying nature that contributes further to consolidation. So hospitals are acquiring a lot more physician clinics. And then when they acquire those physician clinics, prices go up, and there are extra additional bills that are causing surprise to the people who are getting it. So it's a double whammy there. We've got a couple of ideas that we can use to address this. One of the things that we can do is make the billing a little bit more honest. And this is one of these wonky ideas, but on the claim form that's submitted, we want to make sure that that claim form shows honestly where that service is being provided. And by doing so, we can give the payers, the insurers, some of the larger employers out there, better data to be able to address this issue. And then in some cases, like in the case where we're talking about a telehealth service, we just don't think a facility fee makes sense if that service is being provided completely digitally. Um, there are other issues regarding anti-competitive practices, and this is what happens once we start to get outside of the normal way that a market functions, and when you have actors who are pretty close to monopoly status, or at least oligarchy status. There are certain contracting clauses that these market-dominant providers are putting in to take advantage of their size and would never happen if we had a truly competitive market. And so one of the things that we'd like to see happen is some of these particularly egregious clauses, like all or nothing contracting, where if you want to have one really important medical provider in your network, you have to take all of them, regardless of the cost, regardless of the quality. Let's ban that. Let's say that that's not a fair or competitive market practice that inhibits competition, and let's go ahead and root that out. There are a couple other options we have here, and that would be increased antitrust enforcement and maybe looking more at some of these mergers, especially when we talk about the role that private equity can be coming in and taking in and consolidating and rolling up some of these healthcare providers behind the scenes, maybe at a lower level where it's not capturing that insight. But let's get a little bit more serious about that. And to help in both of these, we want to have more increased oversight about who actually owns who. We think there's a consumer-facing approach to this where patients deserve to know who owns their doctor, but it can also help us take a little more of a nuanced and tailored approach to regulation. So we're not just using blunt tools, we're really only going after the actors that have consolidated market power and are prohibiting the effect of that competitive marketplace that keeps our prices low and our quality high. Lastly, we've got some data issues. In order to really do some of our longer, more ambitious goals and to convince regulators and policymakers of this, we need to have better research. And one of the tools out there that can do this is this nerdy database that we call the All Payer Claims Database. It stores a whole bunch of information that lets us come up with really cool research and visualizations to help convince policymakers. Right now, the state isn't funding it. It has all this data available, but because they're not funding it, researchers can't access it. And so we're asking state appropriators to contribute a relatively small amount. It's about $5 million over 2 years to fund that. And that'll allow researchers to access this information. And then lastly, we also want to make sure that insurers are free to provide enrollees with information on the quality of providers. There's been some good work on price transparency recently. It hasn't rolled out fully yet. We're still seeing that happen. But in conjunction with price, the other important component is quality. And that's how we determine value. We need to make sure that patients and health insurers have information on the quality of providers, and that information is conveyed so people can make that decision on both price and quality to determine value. Slide. Now, I'm not going to bore you and go through all of the specific bills here, but I do want you to see we are tracking these pieces of legislation that have already been filed, and note that they are in the midst of this legislative process. There is interest among legislators, and each of these bills, each of these items has a decent chance, some of them even better than decent, pretty good, of being passed, but they also have enemies. There are opponents. And most of the opponents of these are entrenched interests who don't want to see change, because if there's change, that changes the financial incentives. So all of the existing industry players are worried about these bills. And the voices that we need to see have support for these bills are voices like yours, the businesses out there who are being impacted by these high costs. With that, turn it over to Sharon for some questions.
Yeah, and thanks so much, Charles, for sharing all that great information. I know you and I have spent a lot of time talking about how the drivers of health are really impacting the bottom lines of business owners. And so I think that was a really great overview. As you said, now we want to welcome Sharon Jones to the conversation for some Q&A, who is a senior advisor and executive director of the Texas Business Leader Alliance, a newly formed coalition in Texas, working to connect the private sector, government, and community stakeholders to work for solutions at the state level to kind of face those challenges. And so, Sharon, why don't you go ahead and hop on, and we can go ahead and go into some of the Q&A portion. And so for folks who are on the line, if you have additional questions as well, feel free to put them in the Q&A. We may not get a chance to get to all of them today because we're trying to do this in a quick briefing, 30-minute lunchtime chat. But we'll do our best to kind of get through some of these questions there. So Sharon, why don't you take it away?
Thank you so much. Charles, I'm going to start with what might be a hardball question, but it's been a few years since hospital transparency laws were passed in both Washington and Austin. And as we know, prices are still rising. So what makes this legislation that's proposed different this year?
So price transparency is really important. There's been a lot of effort about it. As you know, there were efforts at both the federal and the state level. But as one of our legislative champions is fond of saying, and I've really adopted this phrase, if all you have is transparency, but not more, you just know how badly you're getting screwed. What you need in order for there to be a healthy market to operate is not just transparency, but you also need competition. So you need alternative choices. And then you need this appropriate engagement. And that means that there needs to be benefit plans out there that have the appropriate incentives in place to take advantage of that competition. And that means making sure that patients are given the right incentives to go seek out that high value care, but also on the other side of the equation, that the benefit design is out there that's incentivizing the medical providers to provide that. And so that's that higher quality cost at lower price. And so the bills that we've got going this session are looking at not just that first step, that crucial part of price transparency, but also trying to address the other legs of that healthy market stool so that we have markets that are transparent, informed, competitive, and then engaged so that all three legs of that stool can help to bring down prices while increasing quality.
It sounds like these are sequential steps and not just a one-size-fits-all solution, right?
That's right. There is no, because of how complex the healthcare marketplace is and how regulated, frankly, it is, and how much government involvement that there has been historically in this market. There is no one single silver bullet, and there's a interplay between state and federal appropriations. What we are doing here is taking a long-term approach that will also have short-term actions and real benefits for employers by taking these actions. But there is no single piece of legislation that will fix all of this. That's correct.
You know, the research presented showed how the healthcare expenses are rising and they're preventing businesses large and small from investing in or growing their businesses. How would more competitive and transparent healthcare pricing help businesses reduce these expenses?
So when there's more transparent pricing and when there's more competition out there, this is going to allow businesses of all sizes to take advantage of that to drive down their expenses. Now, for small businesses, you're buying insurance products from brokers. And what this is going to allow insurers to do is to design plans that appropriately incentivize your employees to go seek that higher value care and frankly give them a little bit more negotiating leverage with some of these market dominant health systems so that on the back end negotiations they can actually drive down those prices where maybe historically they've been held over the barrel a little bit. Um, the other side of this is that for the larger employers who might be on the call, they have the ability to design their own plans and they have a lot more flexibility of what they can do. And what we've been doing is working to also empower them to do similar benefit design changes so that they can take advantage of the increased price transparency to promote that competition, because that competition is how we make sure that we're getting the best value at the end of the day.
Yeah, I think that value is going to be important to large and small businesses. Um, how would you recommend that Texas businesses in particular use their voice to support these solutions to skyrocketing healthcare prices?
Great question. One of the things that I hear a lot from businesses, and I'm very sympathetic when we talk to business owners about this isn't what I do. This isn't my core business. And I hear that. That is absolutely understandable. And so what we want employers to do to really make their voice heard is not necessarily feel like they need to own the solution. This isn't what you do. You don't need to be spending your time figuring this out. But if you can own the problem, when you look at your balance sheet and you look at your expenses and you see that the cost of your healthcare is going through the roof and how it's impacting your ability, own that. Talk about that. Have your voice heard that this is not acceptable and that this is not sustainable for your business over the long term. Legislators want to hear from their constituents and their members. And we know that your schedule is busy and that you're busy taking care of your business. But that's exactly who a legislator wants to hear from, is the person who's out there doing the thing, who is out there in the arena working to give their constituents jobs. If they hear from you that this is a problem, they are now motivated to go on and take on the powerful interests out there who have lobbyists at the Capitol every day. But if they're not hearing from you that it's a problem, then those lobbyists are going to have a much louder voice and it's going to prevent and prohibit the change necessary to help you.
Yeah, one of our questions in the chat wants to dive a little bit deeper there and ask, how do you foresee strategizing against parties who don't want transparency for some of these bills?
In some cases, the folks who are against this can be their own worst enemy. And I'll give you an example from something that we did last session. We put forward a piece of legislation that simply required that before collecting a bill against a patient, they had to provide an itemized bill. And this is a very simple, basic transparency measure that almost all of the legislators we talked to said, yep, this sounds simple. We got no problem with this. And some of the folks who are opposed to more transparency, those existing industry members, hospital systems, came out very loudly, very strongly opposed to this. And by doing so, by coming out that strongly opposed to a very simple piece of legislation, they alienated those legislators. Legislators who might have otherwise be inclined to agree with them on certain things, or at least listen to them, said, if you're being so unreasonable on something this simple that I can understand, how can I trust you on these other issues? So what we try to do is make sure that with every piece of legislation that we're putting forward and evaluating, we're being absolutely reasonable and not just going on and looking at it based on who's involved or where the parties are. And by building that trust and credence that we are reasonable and evaluating these things on a basis, we're able to gain that trust and outflank some of our opponents on some of the more complex stuff that, frankly, a lot of the legislators don't necessarily have the time to look into all the details. But if we can build that trust on those small items, we have that available to us to advance our agenda on some of the more complex items.
Yeah, you mentioned trust and credibility being really important. How can business leaders help to find that intersection between process and people and make the anecdotal real stories?
So that's a wonderful question, because there are some legislators who look at this and they want to get into what are the systemic factors that go into play. And there's others that say, how is this impacting my constituents? And both sides of that story are important because all of those legislators have a vote. If you are a business and you have an employee who has been unfairly impacted by high bills or has been receiving one of these surprise facility fee bills, that's a helpful story that your legislator needs to hear. But at the same token, if you are looking at your bottom line, you're looking at your expense sheet at the end of the day, and you see that your healthcare expenses have risen 20% over the last 3 years, and it's threatening your ability to operate, that's that larger level systemic issue that also helps out. And if you want to reach out to us and you don't necessarily know who to contact, we're happy to help put you in touch with the folks who can hear that story and maybe even give you some advice on which legislators are amenable or more interested in which type of story.
Thank you. Now we've been addressing this information, and it's been a lot at breakneck speed. So for everyone on the call, what would you say is the most important takeaway you'd want these business leaders and business folks to leave with today?
I'm sorry, Sharon, that was for me. I thought you were talking to the audience members. Could you repeat that?
Yeah, just because we've been going through this so rapidly today, are there key takeaways for folks today?
So if you're listening here, what I want you to know is that there are organizations out there who are fighting for your interests in order to bring down these expenses. We don't think that it's necessarily your responsibility, but that is the system that we have. And uh, unfortunately, because that's the system that we have, we need to hear your voice saying that it is a problem. There are powerful interests at the Capitol on the side of both our large hospital systems and indeed also on our large insurers who are sometimes working against the interests of you and your employees. And if your voice isn't heard at the Capitol saying that this is a problem, legislators are going to be listening to the folks who are there. So the big key takeaway that we want to hear here is that there are solutions to this problem, but we need to hear your voice saying that this is a problem that you want the legislature to address.
Thank you. Thank you so much. I guess we're open to any other questions and comments from our attendees today.
And we'll give folks another minute or so just in case they have additional questions. But Charles and Sharon, thanks so much for sharing all that great information. I mean, I know personally I learned a lot, so I'm sure the folks on our call today did as well. And honestly, I think the biggest thing, to Charles' latest point there is that business owners have a voice in this fight. We all get our insurance and our health benefits mostly through our employees often. And so I think there is a lot to be said about allowing opportunities for folks on this call to really use their voice to really get out there and talk about why this is so important to not only themselves, but their employees and the communities that they serve. I'd also now just like to bring in Chris Skizak to join us because the thing I heard from Charles and Sharon was that there is a need for business owners to use their voices. And so, Chris, why don't you go ahead and join us real quick and we can bring back up the slides. But for those who are not familiar with Chris is the executive director of Texas Employers for Affordable Healthcare, one of our partners for today's event. And he has been working within the healthcare world, specifically in Texas for many, many years. He's got a great long background in bio. But Chris, I wanted to have you spend a little bit of time on like, how can business owners on this call get involved, right? Like, how can they actually use their voice to advocate for these changes that Charles and Sharon talked about?
Well, thanks for the opportunity, Sammy, and glad to be providing some content here. As you heard from Charles, the hospital industry does not operate under free market principles, and through legislative interference, we're trying to create that level playing field. We were successful in the last session passing House Bill 711, which prohibits anti-competitive language in contracts between hospitals and health plans. It was a huge win for our organization and for employers. Most employers are not aware of that, but we're trying to create that awareness over the next several months. What I would recommend is to check us out on our website at tx.each.org. Again, that's txeach.org. Charles showed the one graph showing the operating profit margins and the break-evens. You can go to that site and play with it and look at the hospitals in your own area to find out how much over you are being charged for services by hospital or by hospital system or by legislative district. One might say that if you looked at that, you could easily figure out your legislator and maybe send them a note. But also going to that website, you can sign up for our newsletter to stay informed. We will be providing legislative updates throughout the session. We produce a monthly newsletter. You can see all of the old newsletters that are on the site with rich content, and it's all focused and oriented towards the interest of employer purchasers of healthcare. One other thing that I would add, and a way you can get involved is to understand your own data. You've heard the expression, he who owns the gold rules. Well, data is like gold. And we, through our organization, are going to be making available an employer guide for healthcare data that shows why data is so important, how to get that data. And when we say how to get it, it provides letter templates of what you provide to your health plan, and then the responses when you're going to get pushback, and you will get pushback most often. And then third, how you can use it to design benefit plans that are oriented towards value. House Bill 711 allowed or prohibits contracts that prohibit anti-tiering and anti-steering clauses. There's a lot that can be done with that legislation. So I would say the biggest thing, go to our website, just start by signing up for our newsletter and staying informed throughout this legislative process. It could be something as simple as understanding it and having a drop card in support of a piece of legislation. So we hope you gain some insight here and learn a little bit more about how important this is to employers, and also a little bit about how you can become part of the solution. So I appreciate that time, Sammy.
Yeah, of course. And thank you, Chris, for sharing all of that. And we, you know, I know you were spelling out the website, but we did want to share it on the screen as well, so folks can make sure that they follow up, because, you know, as we've heard multiple times today, using your voice is so important. And so, you know, the team at Small Business for America's Future, as well as Texans for Affordable Healthcare, you know, we want to hear from you, and we want to find ways to get you involved and help share your story. So visit our website. And those of you who have asked in the chat, we did record this today, and we will be sending out some of the resources and materials that were referenced in today's call. So keep an eye out in your inboxes for some follow-ups from today's event. We also are hoping to do more of these. So if you enjoyed today's briefing, you know, stay in touch with us on ways you can continue to stay involved for future events and opportunities. And we just really appreciate everybody joining us today. And hope you have a wonderful rest of your Wednesday. And we hope everybody stays warm, because we know it's unseasonably cold in some parts of Texas today. And so without further ado, thank you all again, and we hope to have you join us again soon.